Thank you all for being here. I want to go ahead and get our panel started today. I want to welcome you to the UNI Community Public Health Panel on the facts of the coronavirus, also known as COVID-19. We have 7 experts here who are going to be talking to you in a minute. Just to give you a little bit about the logistics of how this is going to proceed, this is, as you know, this is being live streamed on prepare.uni.edu. It is also being recorded. We have one of our experts has some PowerPoint slides that she is going to present. Those PowerPoint slides will be uploaded to the website, prepare.uni.edu after. Should be up there tomorrow, so you'll be able to view those as well. I'm going to introduce each one of the experts to my left. Each one of them is going to give about 5 minutes of remarks, and then we're going to open it up to questions. If you have a question, there are microphones down here at the front. There's also a microphone up in the balcony if anybody chooses to sit up there. So, my name is Chris Larimer. I'm the moderator. I'm a professor in the political science department here at UNI. To my immediate left is Dr. Michele Devlin. She is a professor of global public health and emergency medical technician. She is also a specialist in cross-cultural health, disaster and refugee response, and human migration. Next to her is Dr. Catherine Zeman, a professor of environmental and occupational health here at UNI. Next to her is Shelley O'Connell, the Executive Director of Health and Recreation Services here at UNI. Next to Shelley is Joshua Pikora, Disease Surveillance and Investigation Manager with the Blackhawk County Public Health Department. Next to Josh is Aaron Reinke, an epidemiologist with the Blackhawk County Health Department. Next we have Joseph Razor, Director of Risk Management, Environmental Health and Safety here at UNI. And on the end, we have Phil Plurd, Executive Director for the Office of International Programs here at UNI. I'm going to turn it over to Dr. Michele Devlin first. She's going to give a few minutes of remarks, and each one of the experts will, and then we'll open it up to you for questions.
Thank you, Chris. Good afternoon, all of you. We appreciate your being here for this conversation on corona. So I'm honored to be here today with my colleague, Dr. Catherine Zeman, in our public health program here at UNI. And our job is to really provide you with a 30,000-foot view and put the coronavirus and COVID-19, as it's known, into perspective, sort of historically and from a disease standpoint and culturally. And then we're going to be turning it over to 3 of our medical and public health epidemiological specialists, and then Joe and Phil at the end for remarks on behalf of the administration from that. So let me just say it's important to really understand the coronavirus, COVID-19, as one of numerous EIDs, okay, emergent infectious diseases that we have seen in recent years. These EIDs, these emergent infectious diseases, are becoming more and more common. You've probably heard of a number of them in recent years, right? Like Ebola, Zika, dengue fever, SARS, MERS, and now we're looking at the coronavirus. There have been many. The other challenge that we're seeing now is that it's not random, that more and more of these emerging infections are showing up globally and even affecting, communities like ours here locally in the United States, in our state and these regions of the world. We're seeing a number of different trends going on globally that are contributing to an increase in these emerging diseases. Certainly human migration, we are more mobile and fluid as a globe than we've ever been before, across continents, within nations and provinces, and across oceans and back and forth. We travel more easily than ever before through technology. We are more urban than ever before in human history, and so we have a higher level of density in a number of cities and regions throughout the world. We have millions and millions and millions of people living very closely in contact that we did not previously have. To that extent, as our population increases globally, we're expanding into more and more regions of the Earth where we did not exist before, and certainly not in such density. And so we have more interactions in remote areas and wilderness areas and with different animals, plants, and other environmental vectors that Dr. Zeman will be talking about in a moment. And certainly climate change, different parts of the world becoming hotter or colder, or drier, or wetter than ever before, and how that changes patterns for vectors and viruses and bacteria and other things that affect us and that we interact with here upon the globe. So it's appropriate, I think, that we're here today actually with this conversation and the panel, because the World Health Organization did just declare coronavirus as a global pandemic. So it's now reached the point statistically and numerically, and looking at rates and all the formulas and algorithms that are used, this disease, emerging disease now, has indeed emerged and is showing up all over the world, many different countries and continents, and of course it's novel, it's new. We don't really know what to predict from it and to see where it's going to go, and I think you'll enjoy some of the comments from our Blackhawk County specialists here who are very up to date on a lot of these different trends and patterns and what we're seeing. But it's now pandemic. And I think one of the most important things to remember, and what we've been seeing also, is unfortunately not just an increase in the disease and in its range, but in the increase sometimes in intolerance and misunderstandings and conspiracies and bad information and things like that. That unfortunately has been one of the biggest casualties of this disease beyond the morbidity and mortality that we're experiencing. So as we go throughout this afternoon for the next bit, and as you go back out into your communities, the school, and other areas where you're coming from, please try to focus on scientific evidence, on facts, on what's happening, evidence-based information. It's very important. We need to be aware, too, and to be careful that certain cultural groups or certain populations are not being targeted for this disease, for these conditions, and resulting in bias or racial attacks, assaults, anything like that. And again, misunderstandings. We've certainly seen that globally around some Asian populations, some Orthodox Jewish populations in New York. We've seen it even from a generational standpoint, because the people that tend to be most severely affected by the disease are older populations, right? They're usually 60, 70, 80, even folks in their 50s. And so we're sometimes seeing generational bias and issues going along as well. So I do need to say that here at the university and with our students, staff, faculty, if you have concerns about anything like that, you can certainly visit with the Dean of Students. As a student here at UNI, faculty could certainly talk to their department heads and bosses and human resources. And then we do have a site at UNI online. It's crt.uni.edu. You can just go to that, and if you have any concerns, questions, or issues, again, about misunderstandings, bias, things like that, that would be the place to go for further information and assistance. So thank you. With that, I'll turn it over to Dr. Zeman to give you sort of a visual of some of these things that we've been talking about.
Great. Thank you, Dr. Devlin. I appreciate the introduction there, and also want to point out that, as Dr. Devlin has mentioned, it's not a matter of if this ever occurs, but when it occurs. We're all of us living on a dynamic, living world. Where genetic change occurs constantly, and we're interacting with that dynamic world. So that's why I note it's not if, but when. And of course, you see here the COVID-19 virus that's in the family of coronaviruses. And you can see that already scientists around the world have mapped its RNA and in protein structures and all the protein structures on the capsid, the capsule of the coronavirus. And they've been able to do that and also look at areas where it emerged, look back into animal populations, and in particular, they're focusing on bats. There's 2 articles already published by Yark in Nature Reviews that you can look up later if you get these slides, and you can see how closely the genetic signature of this virus and the proteins it expresses, which of course dock with the cells in the back of our throat and nasal membranes, corresponds to bat populations. Okay, so that's clearly at least where it is a reservoir in the environment. There's debate now about whether it went through another species before finally coming into the human population. But everything that Dr. Devlin had mentioned, the factors for favoring emergence, you just take a look at those, you can see that many of them would have been operative in live animal markets where bats were in close proximity with humans, where animals are often slaughtered for food right there in front of people. There's a lot of blood and body fluids from the animals. And you also find people in close, proximity to one another, so a density of the population. It becomes very clear when you understand those factors that this is where the emergence occurred, and this could be occurring all over the world. If we go to the next slide, you'll just see an example of the crowding in these markets, and this is not to pick on any particular group of people. This is a common practice throughout many parts of Asia, Central and South America, Sub-Saharan Africa. It's a human nature kind of thing to do until populations move away from completely embracing these things. In fact, in China right now, 2/3 of the population would prefer to see the market shut down. The Chinese have actually stopped the sale of the live animals now during this outbreak, and they're going to have some challenges as they move forward, but they're looking at eliminating completely these live animal markets. And finally, go to the next slide here. I have 2 more slides here. You can see the pandemic potential associated with the behavior, if you will. I won't call it behavior. I guess that's anthropomorphizing it. But let's just say the way the virus interacts with human populations, our behavior and the virus together. We see it easily communicable between people, has an RO greater than 1, or how many people can get the virus from someone who has it. It's much greater than that, and I'm sure our colleagues from Black Hawk County Health Department will address that. And it tends to be able to survive for a period of time on surfaces, spread in droplets in the air. So there's a lot of things that favor it becoming the pandemic it has become. And now the final slide is just if you want to find more science-based information about this virus, and you also want to find dashboards that will keep you up to date about the global spread of this virus, sort of keeping it in perspective, you can use the web address there, and I strongly recommend that also taking a look at Johns Hopkins dashboard. It's an excellent dashboard.
I'm going to move that just a little bit here. So thank you for joining us here today, and I know we have some folks joining us online as well. The university's focus is, the priority of our focus is the health and safety of our students and our campus. Our decisions are based on the guidance from the Iowa Department of Public Health and the Center for Disease Control and Prevention. The UNI Student Health Clinic has been in regular communication with our partners at the Black Hawk County Health Department to gain guidance and direction. Much has been done to mobilize resources and expertise to protect the public health during this time. This continues to be a very fluid situation, and you're going to hear that from all of us up here as well. And new information, new cases are arising all over the world. We will continue to be vigilant to remain current on the rapidly evolving travel advisories and public health recommendations that are issued by the CDC, the World Health Organization, and the U.S. State Department, and how these affect our students and our campus. We would ask that students, faculty, and staff take precautions over the spring break period that we're all going to be entering in here too quickly. Good hygiene, I can't say it enough. And if you know me well, you hear it from me very frequently. Stop shaking hands would be one of the things that I would recommend. Wash your hands with soap for at least 20 seconds. Cover your coughs and your sneezes with either your elbow or with a tissue, and then throw that tissue away. And then avoid touching your face. And we were joking up here about how much we touch our faces, so we're all guilty of that. So just try to be cognizant of it. Also, I would say consider cleaning the surface of your phone. And then disinfecting any hard surfaces. The Student Health Clinic is working with campus departments to ensure that we are available when a health concern or question arises. Additionally, we recognize that there is an emotional impact for our students, and the Counseling Center has walk-in counseling sessions available Monday through Friday from the hours of 8 to 4:30 for students who just want to, I just touched my face, sorry, who want to drop by and talk to a mental health counselor. We are available to support students, and if you have been in an affected area and you need to be evaluated, we would suggest that we need you to call us first. We need you to call and tell us where you have been, and we can evaluate your symptoms over the phone and then provide you with some guidance as to what to do next. The Student Health Clinic's primary goal is to provide the much-needed medical services to our campus, and then to help keep our campus safe as well and healthy.
All right, thank you, Shelley. Uh, so I'm going to talk a little bit about our public health recommendations and what people should be doing right now to prepare themselves and to try to keep themselves safe and avoid exposures. And then my colleague Aaron is going to talk a little bit more about our public health response and what we've been doing, the state health department's been doing, and as we've gone through the outbreak, as well as what some next steps might be. And as simple as it may sound, our number one recommendation right now is the same recommendations that we would follow during flu season. And Shelley reiterated them, and I'll reiterate them again. Really cover your cough and sneeze with your forearm, not with your hand. Try to cough and sneeze away from people as much as possible. Make sure you're doing good hand washing, 20 seconds with soap and water. If you can't wash your hands, use hand sanitizer, but hand sanitizer doesn't completely replace hand washing. And do your best to stay home when you're sick to contain those germs and not spread those person to person. I would also recommend regular cleaning at home. Regular over-the-counter cleaners are effective. You don't need any special strength cleaner or anything like that, but just make sure you're doing regular cleaning, particularly of any shared surfaces, counters, doorknobs, light switches, anything that multiple people touch. And then start planning on what you would do, what your family would do if your normal routine was disrupted. So for general emergency preparedness recommendations, we recommend you have a list of contact information, friends, family members, emergency contacts you would need to get a hold of, doctors, schools, daycares, any contact information that you may need to get a hold of somebody if your family is experiencing an emergency, as well as 3-day supply of food, water, medications, things like that. But more specific to infectious diseases and the coronavirus outbreaks, really urging people to think about what they would need to do, what arrangements they need to make if they need to stay home for an extended period of time due to illness. For coronavirus, COVID-19, we're asking people to stay home for 14 days and self-isolate if they've possibly been exposed. And 14 days is a long time, so thinking about how would you handle work or school. If you have children, how you handle daycare arrangements, or if your child was sick, if you needed to stay home for 14 days, or if your daycare provider was sick. How would you get groceries or other necessities if you were ill and couldn't leave the house for 14 days? How would you care for pets? Animals have some sort of role in the transmission. We're still learning things all the time, but right now our recommendation is if you're isolating for COVID-19, that you try to avoid contact with your pets as much as possible. How would your pets be cared for if you need to isolate from them for 14 days? All things to think about as you're preparing. Some other general things to think about for control measures and things to keep in mind. Masks, we get a lot of questions about whether or not the general public need to be wearing masks, and our general recommendation is no. The standard surgical mask that people think about wearing when they go out or when they're in a clinic, that's really designed to help contain illness when someone ill wears, when it catches all the droplets and tries to contain the virus from getting out of the person's body. They're not protective against other people becoming exposed. They're loose around the nose, they're open on the sides, the virus can just go right around them. It's more to keep things in. And the masks that are protective, those N95 respirators that fit tight around the mouth, that's really for healthcare workers and public health professionals to avoid being exposed when they're working with people who are possibly contagious with an infectious disease. And those need to be fit tested really in order to be effective. And but we wear those so we can keep doing our job, so we're not exposed and we can keep working and protecting the public. Wanted to also make a comment briefly about travel. So like we've said, the situation is changing all the time, and if you're planning travel international or domestically, to really be cognizant and keep an eye on the most up-to-date information. The CDC travel advisories is a great place for that, but be in mind that things are changing rapidly, and if your destination would be upgraded to a higher travel advisory level 2 or 3, when we return, we'd ask that you stay home for 14 days to monitor for any signs of illness. And we really need the public's help with helping contain the spread of the disease, because we can't do everything on our own. We do our best to give people information, keep people healthy, but We really need your help in following public health guidelines when you put them out, staying home for 14 days, calling your healthcare provider before you go into the clinic if you suspect you may have been exposed to COVID-19. Other than that, we just recommend, like I said, situation is always changing. I'm keeping on top of the best information. We'll share information as we become available and we get updated guidelines, but the Iowa Department of Public Health website, the CDC website, and then your campus resources would be great places to consult. And if you have any questions, the Iowa Department of Public Health has established a 211 hotline that you can call in and ask questions. All right, thank you.
Yeah, so on the response side of what the public health department is doing, like Josh was just mentioning, we are trying to push out educational materials to the public. So making sure everyone is up to date and using the latest guidance from CDC and the Iowa Department of Public Health. We're sending these out to partners like businesses, long-term care facilities, and healthcare providers. On that end, we're also doing events in the public like this and making sure the public is well aware of what's going on and staying well informed about the COVID-19. Another thing that we're doing is contact tracing, and that is done with the CDC and the Iowa Department of Public Health. And the CDC and the Iowa Department of Public Health would get an alert from someone who is traveling from mainland China or Iran, and they would also get alerts by people who are close contacts of a positive case. And they would draft up public health orders for that individual on a risk basis, so either a low risk, a medium risk, and a high risk, depending on what the state believes that person's risk is on their travel history and their contact. Then they would send and push that out to local health departments, and the local health departments would they would monitor that individual twice a day, and depending on the risk level, it could be low risk. They are not quarantined into their home, but they need to have that self-isolation, so not using that mass transit, and monitoring their symptoms twice a day. Where it goes to medium and high risk, they are quarantined through their home throughout that 14 days, and they would need to monitor themselves as well for those morning and night to make sure that they are not getting symptoms. And that's just a way for us to make sure that they're getting the proper treatment, and if they needed to get tested, they could get tested right away. The last thing that we really do on the response end is working with partners that we have out in the community, so in hospitals, making sure our preparedness plans are set in place and that they say the same thing. We're making sure that we have open line of communication with all emergency response individuals, so we're all on top of everything before it happens and talking about things that could possibly happen. So instead of just waiting for them to happen, being proactive and then setting those precedents. So one thing that might be kind of thrown around a lot is that social distancing. And at this point in time in Iowa, we would not be recommending social distancing measures on like a state level. So that would be, social distancing would be like closing schools or canceling events. And there are trigger points, which Iowa Department of Public Health has said, which would be seeing local transmission. So if we saw a case, say, in Des Moines that had no ties to the individuals that the CDC and the state has seen for the travel history or a close contact, and they just randomly had that disease, then we would start seeing that, oh, that would be local transmission because we can't have that epi-link. And at that point, then we would start considering in Des Moines, we would start doing those social distancing measures. So it would be a case-by-case basis. We wouldn't just blanket all of this for Iowa because we want to make sure that we're doing the least invasive method possible for keeping the civil liberties of everyone in check. So,
good afternoon. Again, my name is Joseph Razor. I'm the Director of Risk Management and Environmental Health and Safety here at the University of Northern Iowa. I'd like to start off by thanking our students, faculty, staff, and community members for their patience and their understanding as we're dealing with the uncertainties surrounding COVID-19. The UNI's primary focus is the safety of our students, faculty, and staff, as well as our community here in the Cedar Valley. Here on our campus, we've been working in a systematic and proactive way to ensure that we're prepared at all levels as it relates to COVID-19 and the coronavirus. We have a large team of individuals working on this issue, and we're utilizing an incident command system, a system designed to enable effective and efficient management of incidents like this. We're following the latest guidance from IDPH the CDC, and Black Hawk County Health. And I'm glad to see Black Hawk County Health back on our campus. They've been tremendous partners as we seek to protect our students and university community as it relates to COVID-19. As an email went out earlier today, all on-campus courses will switch over to exclusive online instruction beginning on Monday, March 23rd through at least Friday, April 3rd. Additional information regarding this switch and other updates can be found on our website, prepare.uni.edu. And if you have any specific questions, you're welcome to email those to prepare@uni.edu. We'll continue to manage the situation in order to protect the safety and well-being of our students, faculty, staff, and our community. And on one final item, we all know that there's a lot of stress and uncertainty that relates to COVID-19. This can bring a lot of strong emotions, but one of the most important things we can do is to remember to maintain patience and understanding, as well as our inclusive values. Please demonstrate respectful behaviors to all members of our community. And if you witness any negative behavior, please report it immediately to the Office of Compliance and Equity Management. Thank you.
Thank you, Joseph. Again, I'm Phil Plord of International Programs here at UNI. I want to follow up on something that Michele said and Joseph has also said. Biased behavior towards others because of the fact that they come from a foreign country, I think, is just not representative of the values that we teach here on this campus. And anytime we see that kind of behavior, we should report it. We did ask persons to submit questions before this panel started today, and I want to address two of those questions. One of the questions was, how are we supporting our students, our international students, who may be experiencing racism or xenophobia in relation to the current health issue? So we, as a division, international programs, have 3 subdivisions, and these are all persons working with international students here, as well as our domestic international students going abroad. One of them is sitting amongst you now, Dr. Isabella Varela, who's head of International Students and Scholars Office. Thank you, Isabella, for being here. Another person is, before I move on, Isabella is also working with a group called the GPS. This group is Global Panthers for Success. This group of 7 students is all international. They're very plugged into the community here at UNI. They report back to us once a week. They meet, they talk about what they're hearing, what's on the ground, and then we react to what they are telling us. Yes, they are telling us that internationals are a little concerned, but at the same time, I am happy to report that we are not hearing cases of biased behavior is not being reported back to us. We're not everywhere, but we are hearing that. However, if we are hearing something, or if you think you see something, please tell us. Another person on that division is Director Paula Van Zee of the Study Abroad Office. She is also another set of eyes and ears on the ground here. She lets us know what our international exchange students are feeling, and I appreciate her support. And of course, the last person is the director, Carolina Coronado Park, of the Culture Intensive English program, and she is also working with internationals who are on our campus and being instructed in English and cultural training. Again, she's another person with eyes and ears on the ground to listen to our internationals and what they may be feeling, and I appreciate her support as well. I don't see her in the audience. I'm not sure if she's here, but if Paula and I see Isabella, but if Paula and Caroline are here, thank you for your support. The other question that was raised before to the panel was, what resources are available to the international students who are attending UNI, and how do we plan to support them? We understand that the students, many of them are fearful to return to their countries because of bans on travel or restrictions on entering the United States, or maybe entering their own country, possibly. We are asking those students now to respond to surveys that I know the ISSL office is doing to learn where they plan to be over the summer, and if they do plan to be here, to tell us so that we can help plan for their experience here. Say if they need courses fulfilled, we would try to make some courses available to them. We know all their majors, of course, and we're communicating that to our provost office, so working with the deans to understand what these students' needs might be if they are here over the summer. We have approximately 250 internationals on campus at any one time, and those students, maybe several of them and it may be just more than several, maybe quite a few of them might remain on campus over the summer months. We want to provide employment opportunities for them if we can on campus. They are not under their regulations for visas. They are not allowed to simply go off campus and work, so we would have to see if we can provide something for them here on campus. We are also providing counseling to these students. I want to give a big thanks to the Counseling Center here on campus, which has been having special sessions just for internationals to talk about what stress and anxiety they're feeling during this time of health crisis. That's all the comments I have, so I'll give it back over to Chris.
All right, thank you, and thank you to everyone on the panel for your comments. At this time, we'd like to open it up to questions. As I said, there are 2 microphones down here at the front. Does anyone have any questions?
Gathering here today. One of the things that I've been asked in light of the cancellation of abroad travel is the likelihood of cancellation of domestic travel that's deemed non-essential, and if anybody has any updated information on that topic.
I'll address that question. That is something that we are currently looking at. We will be sharing information at some point in the future as regards to domestic travel. To your comment, Dr. Lang, we have addressed international travel, but we are evaluating domestic travel as well as we seek to protect our campus, our students, and our faculty and staff.
Good afternoon. First, I'd like to thank you for having the panel. I think it's really great that you can bring some consistency to the facts, because I see a lot of things going on in social media that aren't based off of facts and are, I would say, quite frankly, based off of emotional decision making. So, hats off to that. I have really one topic, and it has 2 questions. It's around the idea of relative math. So the first piece of it is when you look at these maps and you go and you look at the number, let's say it was 5 today, and oh my gosh, it's 10 tomorrow. I think people in their mind, including myself at first, will say, oh my gosh, it's doubling. This is an exponential thing. And then the other part of my mind is saying, well, wait a second, maybe there are already 10. We just finally got the other 5 figured out and tested. So some guidance on that. And then the second thing that I'm observing that's related to what I would call relative math is that people are comparing and contrasting this to the flu virus. And they're saying, okay, the fatality rate, on one hand is, I don't know the exact numbers, I'm sure you do, but I've heard like 0.2 versus 2% or 3%. I'm sure you guys know that off the top of your. So that's a 10 times factor. That's really scary. And then I hear people saying, well, this isn't as scary. What are you, so concerned about? Because there's 34 or 3,500, whatever today's number is, of deaths. And we had, 60 or 70 or whatever in 2019 of flu. So then they're like, there's a population that says, don't worry about this. This is nowhere close to the flu. And then there's a population that's looking at the math saying, oh my gosh, this thing's growing exponentially. And oh my gosh, this is an exponential fatality rate. So that's kind of the things that I'm observing and seeing. I was just interested if you had any guidance on that math that some, people that are into math might be doing.
And I can address those to some extent. So for the, particularly if we look at the cases in Iowa, we've seen was 3 Sundays, now 13 as of yesterday. And I haven't seen if new test results have been available yet today, but that number has been going up sharply. And to that point, it's scary because it's increased 4 times in 2 days, but that's also our public health action at work. That's us identifying, doing that contact tracing, figuring out who was exposed, who who needs to be tested and doing that public health work to find those potentially ill people who are exposed, get them into isolation and quarantine as soon as possible, so that when if they become positive, they've been isolated as much as possible and we've limited that spread. So we would expect to see, once we start doing that public health action, we're doing our surveillance, when we're looking for more cases, we're going to find more cases, like you said. And then for the coronavirus, the COVID-19 versus influenza, they do get compared a lot, and we've used that comparison ourselves as kind of a way to educate people. I just used it earlier today about using the same recommendations for flu season. But they are very different issues, and the diseases are very different, although they have some commonalities behind them. Like you said, the mortality rate's very different, estimating somewhere looking like 3 to 4% for coronavirus to typically a fraction of percent for influenza. If you look at our numbers from what we saw as even in the U.S. last year for influenza and look at what we've seen for coronavirus right now, it looks like influenza is the much larger threat. But it's kind of comparing apples to oranges, because for influenza, it's the enemy that we know. It's a disease we're very familiar with. We have control measures. We have vaccine, antivirals, things like that. And with coronavirus, it's new. We're still learning. We don't have those same preventative medications and treatments available. So they're both a threat. They're both a concern. And as we kind of learn more and put up more public health guidelines, it'll kind of inform our actions, and we'll be trying our best to keep people informed, keep people safe.
Those case fatality rates appear to vary, the way it's looking, pretty significantly by decade and by age. So overall, roughly 3.5%, something in that range, we think. But then let's say you look at people age 60, 70, 80 years old, in that range, those fatality rates can run anywhere from about 4% to 15%. So it really jumps depending on what population you're looking at. So yeah, it's a great set of questions that you asked, sir.
Thank you, Michele. You did jog my memory. I should have mentioned that, and likely the mortality rates right now are slightly overestimated, as we aren't identifying as many of the asymptomatic or the less severe illnesses. Those rates will likely come down as we get kind of a full picture of what the scope of illness and transmission was.
Okay, I would also add, relative to that discussion, and maybe Shelley would like to add something too, is you need to think also about the critical care percentage of individuals who may need critical care, critical hospital care. And as we've seen in countries that have been dealing with this, number one, we have no innate immunity to it. It's emergent. All of us have some degree of immunity to the flu. We have no innate immunity to this. And the idea is to flatten out that epidemiological curve as much as possible to relieve the pressures on critical care resources, which can become swamped with it. I don't know if Shelley wants to address that a little bit.
I think what you're saying is the people that need to be tested because of the fact that they are experiencing acute respiratory distress are going to be the priority. And so knowing that and the availability of the testing and things like that are all going to be factored in, and as more become available, we will be able to lower that number because we'll be able to test more people, so like you've indicated.
Good afternoon. Thank you for being here. My name is Paula Knudsen, and I'm the Vice President for Student Affairs. And in that role, I have the capacity to talk to a lot of students. And what I'm hearing from students is that, well, I'm healthy. This isn't going to affect me, so I'm going to be fine, and I'm not worried. And so in having the conversation, it's not necessarily about you. It's about the people who are higher at risk. And we know we have students on campus who have pre-existing conditions, as well as older individuals or others with pre-existing conditions. So do you have any advice for those who have pre-existing conditions, or for those who are friends, and how they can support to keep them healthy?
So that's a very good question, and I wish I had a very good answer to go along with that very good question, but unfortunately we don't have additional guidelines for people with pre-existing conditions around extra precautions that they can take outside of following those general recommendations and things that we've laid out, making sure you're doing those good hand washing, covering coughs, people staying home from their ill. But like you said, sometimes it's not always about what you can do; it's what other people can do around you. And it'd be one of those things if you have pre-existing conditions, making it clear to family members that if that separation is important. If someone is ill in the household, trying to keep people as isolated as possible to avoid spread of disease, extra cleanings at home, things like that.
The CDC has also recommended for individuals 60 and above to delay any kind of discretionary travel if they are planning that and they can, and maybe to try to avoid larger crowds. And I don't know that they've settled on a number. I've heard 100, I've heard 250. So, but to avoid larger crowds if you're in that age group, 60 and above, especially with heart conditions, high blood pressure.
Another question? Go ahead.
Yeah, I have a question. I'm a student here at UNI. When do you think this is going to level off? Do you have any prediction of that? Because I just keep on wanting to wake up in the morning and hear, everything's fine. Let's just return to everything as normal, but I haven't heard that yet. And just how do you keep morale up? That's also a concern of mine, too. And also, one more question related to that, too. I'm healthy. I don't have any autoimmune disease, and I'm young. What should be my level of concern? Are you guys worried, like, when it comes to young, healthy people? Because I know there is a concern when it comes to people who do have, like, underlying diseases. But is the media hyping this up, or how much concern should we have?
I could address that if I get a minute here. I think that, I'm not freaking out concerned, but I'm soberly concerned. And I think you should all be concerned to protect those around you who are more vulnerable, like your parents and grandparents. And you wouldn't want to spread something to them that would, cause them to become seriously ill. So I think that the way we get through this, and we will get through this, there's another side to COVID. But the way we get through this is by working together with a sober approach to this and using sound science. And, it seems simple, right? Wash your hands, don't touch your face. But listening to these gentlemen from the public health department, they're giving you good information here, and just not panicking over this. I know it's scary because it's different, but it could be worse, but it's not a joke either, if that's any help at all.
And I think some of the statistics that you were talking about earlier and that are being shown, looking that, of the cases, maybe 80% or so where people are actually going to get symptoms are either going to be relatively mild or maybe even not at all. So asymptomatic. It's really more about 20% that might get, conditions that are more serious, and then, about 15% and 5% much more serious. And most of those more serious cases you'll see then in the people that are either older or have some of these underlying health conditions that make them weaker, more immunologically weaker. So again, I think in terms of morale, just really focusing on facts and evidence, not getting looped into, conspiracy theories and, wild things on social media and that type of stuff, going back to major sources of real information where you can double check that. And again, to understand it is a novel virus. It is new. We are still learning about it as we go. And I think, again, a 30,000-foot view, this is not the first emergent infectious disease that we've seen. Again, as you've heard, they are coming more commonly now because of all these different factors that Dr. Zeman and I talked about. So we've had some in the past. We have this now. I guarantee you this is not the last that we will be getting. And one thing to consider is that we are learning very, very quickly how to deal with a pandemic that has really reached into areas of the world that we don't always expect to see these kinds of things. And we're kind of all going through it together. And we're looking around the world and looking at best practices and what is working in other countries and other regions and other states, and sharing that information. So we're really learning as we go, so that when we do get over this and we've got more immunity or vaccination, vaccines come up within, next year and a half, year or so, we've bought time, we've learned how to deal with this, and we can be more prepared in the future for the next infectious disease coming about emergently.
And to kind of answer your question about when will it level off, we don't know about this particular virus if it's going to follow suit with other coronaviruses, but they do not like warm weather. So usually at that point on the SARS epidemic that we saw previously, that went away during the summer months, and we're hoping that follows suit. But another thing that we're noticing now is in China and South Korea, their new infection rates are drastically reducing. So we're seeing that we can do countermeasures and it can reduce the spread of that disease. And another thing, just to kind of hit on that last little part that you were saying about how worried should you be as a young college student. So about only like 2.4% of people who are getting infected are younger than 19, and the average or the median age of people who are infected is about 51, and a majority of individuals who are being infected are aged 33, I believe. I have the numbers right here. Because the WHO actually had just recently put out a report for this in the Chinese epidemic. So, and the CDC has also released some information because there's a lot of papers going around showing different numbers. But I would stick with WHO and CDC if you're going to be looking at this information. And they said that the majority of cases would be 39 to 63, and that's 77.8% of individuals who are infected.
And just to echo something I had mentioned earlier on those slides, if you go to that Johns Hopkins website at the bottom, you will find those WHO papers and CDC resources, links to those.
And if I can echo that on the Johns Hopkins site, they have a terrific dashboard, and they've really been at the forefront with some of the information they've shared on this. You can find a link to that site on prepare.uni.edu under external resources.
Great. Question?
Hi, I just had a couple of questions. I had heard that the HIV viral medications was used to treat this virus and was effective. Is that true? And I'd not heard anything about pets before today. And so are you implying that your pets can get this virus?
So I'll start off with the first piece and then answer second if anyone has more information on the first. I haven't heard about the HIV medications being used to treat, but if someone else has read a study on that I had missed, let me know. And then on the subject of pets, so as Dr. Zeman presented, that we believe this virus originated and jumped to humans from animals, and it appears that it's able to jump back. The full extent of that and the full picture that is still needing to be understood, and that'll take some more research before we get a full grasp on that. Early indications are that it can jump to pets and causes a mild illness, but then it does not jump back to humans from there. But like I said, more research is being done on what exactly this disease looks like in animals.
For that HIV treatment for the COVID-19 treatment, I have heard of that in the early indications of that's what they were using. I haven't heard anything recently. I know there are a few other drugs that the FDA has been doing open studies with NIH, and they seem to be somewhat promising. So we're going to see how the outcome is going to be in the next couple of weeks. So.
Question, Mike?
And thank you, like everyone has said, for being here today. Just have a question. Maybe it starts with Joseph, or maybe someone else. But help clarify. Obviously, all these campuses are acting a little bit differently from one end to the other. How do we look at our response of saying there's no academic in-person interaction in the classroom? However, we're allowing interaction outside the classroom in various areas, whether it be at an event in the Gallagher Blue Dorm, something in Mocker Union, the library, wherever it might be. How do we look at those things differently to say that they are different? And then the other question would be, just because I have a kid in high school, is how do we, from a public health standpoint, how are we looking at the K-12 system differently than the college system here in Iowa?
So Mike, to first address your comment regarding events, we have compiled a list of upcoming events, and we are reviewing and discussing what actions, if any, should be taken as it relates to campus events. Regarding classrooms and instruction, That email went out today. What we're looking at there is in typical classroom space, you have anywhere between 12 to 30 people sitting in close proximity to each other. And so that's what we're part of looking to avoid through a form of social distancing.
And to answer your question about that K through 12 area, we're treating it a little differently, not just because the infections are a little bit different, but also because when you close schools, the kids don't just disappear. They have to go back to their homes. And then, so if someone has their child come home and now they have to have childcare or something like that. So it's a lot of considerations, especially for children.
And just to get back to your comment there, Joseph, I think the hard thing for students and even us is that I don't know if we see a classroom versus a student organization meeting or any other gathering to be different.
That's very good feedback, and like I shared, we are looking at events and having those conversations for the reasons that you stated.
These runs on toilet paper and hand sanitizer that are mostly based off of fears and kind of people jumping to their own conclusions. How do you calm those fears and keep people from rushing to the stores?
And I think that's a very sensitive subject, and we do our best to push information out like this, through speaking events like this, put information out in press releases, share IDPH guidelines, and try to get the information out there on what we recommend people do to protect themselves, what they need to do if they need to stockpile certain items. But it's hard to combat mismessages, but the best we can do is work very closely with our media partners, and thank you for being here today, and keep doing these types of events and pushing information out to keep the public as best informed as we can.
And sir, I wanted to follow up on your point about the question about what do you do with schools and when children, are quarantined or sent home. Again, I think one of the biggest casualties of this disease, as we talked about, are not just from a patient standpoint, an individual patient standpoint, but what we're seeing in the ripple effects from a public health standpoint. So there are a lot of conversations going on right now in the public health world and the school health world about what happens to kids that get sent home because of this type of condition, rightly so in terms of not being able to be together, but especially in lower income communities or places where we have significant health disparities, we would expect to see big challenges, and with children that may not have access to school lunches, and food and meals like that are, covered through other mechanisms. If they're living in dangerous neighborhoods, are they more exposed now to neighborhood crimes? Are they more exposed potentially to abuse and, being victims of abuse, domestic violence and those types of things? So many, ripple effects and these second and third order effects and consequences of a public health decision will always create additional decisions and ramifications that we're really going to have to be looking at. So it's a challenge globally that a lot of countries are struggling with.
And I might do one question that was submitted, and Phil touched on this a little bit, and since we have Mike here as well, how would academic supports like the library, Gilchrist, or the union be affected by a remote or online shift? I know that announcement was made today, but I didn't know if you were able to share a little bit more about that.
As regard relates to facilities like the union or Rod Library or other areas on campus, the campus is remaining open and operational during this time. So those areas will be available to our student body and our university community.
Great, thank you. Question? Go ahead.
So I had a question. You've talked about the 2-week isolation period for people who potentially may have been exposed. So say you are a person who's self-isolated and you do then start to show symptoms and you test positive for the virus. What if you are a healthy person again? Is then the continued isolation for that? Is there an additional period you will remain in isolation while you remain symptomatic? Or what is then after that 2 weeks, if you are a person who tests positive, what is the follow-through time period that you would be expected to be self-isolated at home or something like that, and what should someone expect should they be a person who would test positive?
Yeah, that's a very good question. And right now, we don't know the viral shedding period, so how long you're going to be infectious. And we're comparing it to the previous outbreaks of coronavirus like SARS and MERS, and those were about 12 to 14 days at the peak of the virus. But for what we're doing on the public health side is if we're monitoring someone, they would have to test negative twice for that virus, and then they would be considered virus-free.
I've heard contradicting reports on the number of test kits available. Do we have test kits enough for the state of Iowa? And what is a test kit? Like if I would come down with the virus and I call in, do they send someone out to my house to test me and blood test or what? How does
Yeah, so the availability of tests is now becoming more widely available. As of recently as Monday, Quest and LabCorp have released their testing capabilities. So it's no longer on the CDC and state health laboratories. So now doctors and physicians are able to request those reference laboratories and those tests. And those tests would be a nasal pharyngeal swab, so something that you would get for like a flu test. And then they would send that over to the lab and they would do an RNA extraction. And then what that really is they break up the virus, they test that DNA that they have or RNA, and then they would see if you have that coronavirus. I think Josh is going to talk a little bit more about the symptoms and stuff.
So when we're asking people to self-isolate after travel, we're telling them to monitor for symptoms, and we're really looking at fever and then those respiratory symptoms, cough, shortness of breath, difficulty breathing. And if during those 14 days you were to have those symptoms, we'd ask that you call your healthcare provider before going in, let them know about your travel and your symptoms, and then they would work with you to arrange for you to come into a clinic. Likely they'd have you, they'd meet you at a private entrance, take you back directly to exam room to assess your risk, get your test collected, the swabs, and get that sent down, and then you'd be asked to remain home while those tests are pending.
I just wonder if the recommendations about normal instructional activity would preclude office hours or one-on-one instruction where we don't have classroom proximities.
In regards to a question like that, I would advise you to go through the speak to your supervisor in academic affairs, and they'd be able to provide specific guidance. But classes are able to be taught online, either here on campus or at off-campus locations.
Any other questions? Do the panelists have any kind of final remarks?
I will share, we had a question submitted online that someone had brought forward. And it was a really good idea, and it's a great thing to share with this group, with those visiting as well, watching this online. The question was regarding chats and the addition, how they would include the wax paper that they would include to grab the baked good and then put it in the bag. And so we actually shared that with chats, and they're now going to cease doing that. So if you see anything in your work area or around campus where you think, this is a high-touch area, are we thinking about this? Please go ahead. You can share that to prepare@uni.edu. We look at those. We take those very seriously. This is a great example of that. So I'd encourage everyone who's with us today, if you see something, please go ahead and make us aware. Thank you.
All right. If there are no other questions, please join me in thanking our panelists up here today. And thank all of you for attending, and that concludes the panel.